Hello and welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia and I'm your host. Today we've got an episode where we're going to talk about smoking, specifically cigarettes and tobacco, and what you can do either as someone who is dealing with a tobacco addiction, or if you have family or friends who are dealing with this. We'll give you some kind of practical suggestions on what you can do to try to reduce or to stop consumption, and some really practical things on things you guys can use. So we'll be back right after this message. Welcome back. So as I mentioned before the break, we're going to talk about tobacco today and kind of cigarettes, and how to, again, help either yourselves or family or friends reduce consumption. Hopefully you guys found last month's episode helpful. Obviously we talked about sleep apnea last episode. So hopefully, again, if you've got a family or friends or yourself and you wonder whether you have sleep apnea or some of that resonated you with potential symptoms, again, don't forget to get a sleep study and to get checked out for that. So if you didn't see the episode, you can still see it online on the Rogers London webpage. So again, today we're going to talk about tobacco and cigarettes. So it goes without saying that cigarettes, tobacco products are one of the main factors in ill health and disease that we see in practice. We'll put it right up there with obesity and alcohol. But in terms of something that is potentially reversible, that can lead to disease really across all spectrums of your body, tobacco is right up there. So, one thing that before I even address with people to get them to try to quit or to see where they're at with things is to make sure they at least understand the risks of it. And that's not to kind of, hammer away at them, and to tell them that, they're harming themselves in all these ways, but it's important for people at least to understand it and to not to be a mystery. Because truthfully, I've had patients who didn't know that cigarettes increase the risk of heart attack and stroke. Right? That was something they didn't know until I told them. So again, it's not a scare tactic. It's not, we're telling you all these things to create a dark cloud and to make you feel guilty for smoking, but it is important for you to at least understand the risks. So what are those risks of cigarette smoking? So first we'll talk about cancer, because obviously this is the one that people think about most when we talk about tobacco. So what cancers does it increase? Certainly lung cancer, no doubt there. That's been well established over the years. Throat cancer, esophageal, gastric cancer. I've had patients who I can tell you personally who've died of each of these cancers directly attributable to cigarette smoking, and unfortunately many have passed away. Colon cancer is one that doesn't get talked about in linking to cigarette smoking much, but we know one of the main risk factors for colon cancer is cigarette smoking. Family history plays some role as well. Diet plays some role, but cigarette smoking is a huge risk factor for colorectal cancer. So those are all your cancers. So, and again, no secret there when it comes to cigarette smoking. But what else does it cause? So I mentioned it earlier, heart attacks. So cigarette smoking, any tobacco consumption will increase the risk of heart attack, stroke, and peripheral vascular disease. So what is peripheral vascular disease? So when we talk about heart attacks, we talk about the narrowing of the arteries going to the heart and supplying blood flow to the heart. Strokes. So in some people who have risk factors, they get narrowing of the arteries going to the head, and sometimes those can break off and clot and cause decreased blood flow to the brain, causing a stroke. But that same thing can happen in your legs. So some individuals, primarily smokers, so in my experience in people with peripheral vascular disease, so primarily smokers can get a condition where they actually have decreased blood flow to their legs. And why is this important? Well, in some patients, that blood flow and that narrowing of the arteries can be so significant that can actually give pain in the legs, can give changes in the color of their legs. And in some cases, when they don't get the blood flow they need, the tissues in the leg can actually, you get something called ischemia, where if we don't fix the issue, either through medications or even a bypass surgery to the legs, they can actually lose toes, lose legs. So these are actually important things. Again, this is not something that the majority of smokers will get, but it's something that we do see in smokers. And I think if I look at the majority of my patients with peripheral vascular disease, the overwhelming majority have been smokers. Okay. What else does smoking cause in terms of risk? We talked about cancer. We talked about vascular disease. Something as simple as rotator cuff disease. This is something that most smokers don't realize, but one of the biggest things that they'll notice is when they injure a rotator cuff, the likelihood of it recovering as quickly as someone who doesn't smoke is reduced. Why? Decreased blood flow to the area, decreased healing overall from people who consume tobacco. So again, if you're a smoker or know someone who smokes who suffers from kind of chronic shoulder pain or chronic rotator cuff disease, quitting smoking can actually have a fairly tangible effect on the recovery. What else? Chronic pain. We know people with chronic pain who smoke experience chronic pain at a higher level of intensity than those who don't. Someone who suffers from back pain, quitting smoking will sometimes actually help your back pain. So these things that we don't often think about related to smoking, but actually do potentially give quite a bit of benefit when it's addressed. Away from the health, risks, financial, this, is not going to be news to anyone who smokes, but certainly not cheap to consume cigarettes on a regular basis. Even if you're getting cigarettes in less than legal ways, it's still not cheap. If you look at the average person who smokes for a lifetime, pack a day, buying them at the store, paying the exorbitant tax that goes along with it, but average person will spend once interest is accrued 200, 300K over the course of their life on cigarettes. So this is my argument to younger people, certainly, to think about quitting before, that's a house that you're essentially burning up over the course of a lifetime. Back to cancers really quickly. One cancer that's not often talked about, especially for young people, because for young people, when it comes to the risks of cigarette smoking, it's kind of, they look at it as an older person issue, right? I'm not going to get cancer till I'm older. I'm not going to get heart disease till I'm older. But in younger women, we know smoking does increase the risk of cervical disease. The reason that you go for PAPs on a regular basis, and healing of the cervix is not as good in smokers as those who aren't. So if you have early abnormal cervical changes and you smoke, there's a higher likelihood of that actually becoming something that will need intervention compared to someone who doesn't smoke. Okay. Last health issue from smoking, and this is probably the one that affects quality of life for the longest. Subjective, I know, but it's chronic obstructive pulmonary disease or emphysema. This is something that if you smoke for long enough, you'll probably end up getting some element of this at some severity. And some people, unfortunately, develop COPD at such a severe level that they need oxygen, that they're requiring hospitalization on a regular basis. I can tell you there's probably no more a sad way for someone to spend the end of their life than with COPD, short of breath with the smallest amount of exertion. So again, COPD is another consequence of smoking in some individuals. So again, not to be again a black cloud, but again, you have to know all those risks. And again, it's not scare tactics, but just putting those risks and making sure that they're understood. So let's start off with someone who smokes, or someone who smokes. I'm like, where do we start? Where do we start with trying to address this and seeing where they're at? So the first thing we need to do is to at least ask somebody, do they smoke? How much do they smoke? And have they thought about quitting? That's the very first thing I ask somebody, is if they've thought about quitting. Because there's nothing worse when you're talking to somebody who smokes and jumping right into, you have to quit. It's horrible for you. Why are you smoking? If you start with that, you're not going to get anywhere. People are going to feel defensive. They're going to feel attacked, and it's not going to be successful. So starting off just with the open-ended question of have you thought about quitting? What do you think about your smoking? Very open-ended questions. And if they've thought about it, asking, have you, how deeply have you thought about it? Have you thought about setting a date? Have you tried stuff? Kind of what's been their experience in the past with quitting? Because everybody who smokes for long enough will have some experience that they'll be able to kind of pass along and tell you about what their experience has been. And no two people are the same when it comes to smoking. Everyone has a different experience. Everyone's had different experiences with quitting. Everyone smokes for different reasons. So that comes to, the very first thing I ask them after we kind of establish that they're even open for a conversation about quitting, is asking them why they smoke. And that's not a kind of a demeaning question, come on, why do you smoke? Why do you possibly smoke? But legitimately asking them, what benefit do they feel from smoking? Okay, because everybody consumes any harmful substance for some reason. So for smoking, why do people smoke? Some people find it relaxing. Some people do it because if they don't smoke, they feel the effects of nicotine withdrawal. Some people smoke when they're in stressful situations. Some people smoke when they're in certain social situations. So we need to, before we even start to try to address how do we help them to not smoke, we need to figure out why they're smoking. Okay. And again, take some conversation. Some people may not even have thought. A lot of people who smoke have never actually thought about why they smoke. They just started and they've been smoking for 20 years and they've never actually taken the time to think about, okay, what benefit am I getting from this? What positive, and it's weird to think about, but what positive thing are they getting from the smoking, right? The net is negative, of course, from a health perspective, but what positive are they feeling from the smoking? Because if it's relaxation that they're feeling, if we want them to quit, we're going to need to figure out how to get them relaxed in a safer way. Is that meditation? Is that yoga? Is that breathing through straws, as we actually suggested to a patient just this morning? What is going to be that thing that can get them feeling relaxed? Is it a nicotine issue? Okay, how do we tease that out? Well, if their first cigarette was shortly after waking in the morning, and they're pretty reliably needing that cigarette, soon upon waking, we can feel pretty confident that they're going to need some element of nicotine replacement as part of their treatment. If it's somebody who, again, spoke to a patient just this morning, who smokes every few days, can go days without, nicotine's not going to be as important for that patient. It's more behavioral. We're going to need to address the situations that they smoke in, and again, if it's stress, how do we address that stress in a safer way? So again, finding out why they smoke, and for a lot of people, it's a combination of different things. And you may not get an answer the first time they think about it. You may need to give them a few days to kind of go through their normal routine and figure out what their pattern is. I find it helpful to have patients do a diary where they actually write out, for a few days, I had my cigarette at this time. What were you doing at the time you were having that cigarette? How are you feeling when you had that cigarette? How did it make you feel before and after? These things are actually fairly effective. I know these might seem kind of, hairy-fairy and who has the time to do a diary, but if you actually put that time in, I actually find it can be quite helpful in kind of evaluating our own patterns with this. One thing that I find quite helpful, this is with any kind of change that we want anybody to engage in, is we need to find out kind of how ready are they to make that change. So for tobacco, people are at different stages. I've had people tell me, I'm never going to quit smoking. Please never ask me again because I'm never going to quit. And we've agreed to, leave it at that. I've had patients who are continually in a stage where they're ready and motivated, but have just never been able to kind of get to that stage of being lifelong non-smoker. So there's a few questions that I ask patients to get a sense of where they're at in terms of their readiness. So the first question I ask them is, how important is it for them to make that change on a scale of 1 to 10? 1 being the least, they don't think it's important at all, and 10 being very important. The reason I ask them that is that if someone, let's say someone is not, you don't get the sense that they're taking cigarette smoking seriously, they don't want to quit. It's always kind of, you're always hitting a roadblock. And you ask them from 1 to 10, how important is it for them to quit? And they tell you a 3 out of 10. It's an opportunity for you to say, well, 3 out of 10, right? Why 3 and why not 1? Like so you're at least a 3. So it sounds, tell me a bit about why 3 and not 1. So you get them to actually explain in their own words that they at least acknowledge that it is somewhat important, has some element of importance. And then you can ask them, if you're at a 3, what would get you to a 5 or a 6 with this change being important enough to you? What would make quitting smoking being important enough to you to make it a 6 out of 10? And they would say something like, well, if I got sick or something along those lines, right? So again, you have them articulate it in their own words, which makes it, again, resonate a little bit more, a little more effectively than if I'm just lecturing, right? Saying, yeah, it's very important for you. Why don't you understand why it's important? Have them say it in their own words, that they actually do acknowledge that it is important. So again, we talked about importance from 1 to 10. Next question is, how confident are they to make that change from 1 to 10? Because somebody may acknowledge that quitting smoking is very important, but they're not confident at all that they can make that change, either because they tried quitting before and it hasn't gone well, or they're just in a state of life where they're just not optimistic that they can make that change. So again, from 1 to 10, how confident are they that they can make that change? And again, if they're a 5, great, you're a 5. What would make you a 7 in terms of confidence? What would help you be more confident with making that change? And the last question I asked them is, how ready are they to make the change? Because someone could be, acknowledge that it's important. They could be confident that they can make that change, but they're just not ready. So again, 0 to 10, how ready are they now? And what would make them more ready? Why are they more ready than a 0 out of 10? Again, because you'll have, and I have patients all the time who believe they can quit smoking. They know it's important, but now's not a good time, right? I saw a patient back in the spring, and he quit multiple times in the past. He knew it was important. He wanted to quit, but summertime wasn't a good time for him to quit. So we agreed on November as a quit date, and he's actually established that. So we get to quit dates, which I find to be quite helpful, because the one thing that I often see with smokers is that, or people who smoke, is that it'll be this continual kind of, yeah, I'm gonna, I'll get to it. I'm not quite ready yet, and the can gets pushed down the road, and that's just the nature of, I'm the worst procrastinator of all myself, so I'm in no position to criticize. But unless we're kind of put to a deadline and this is the time, it becomes very easy to kick that can down the road. So often I'll at least put it out to them, right? Are you open to the idea of setting a quit date? Not insisting on it, but are you open to the idea of setting a date? Next week, next month, next season? What date can we kind of put that, you'll be ready to start the process of trying to quit? And for me as a physician, obviously it gives me a timeline where I can reach out to them the week before. But for the patient, they can kind of, leading up to that, start preparing, right? What do they need to do in terms of life to prepare for that moment? Do they need to get rid of their ashtrays? Do they need to smoke whatever they have left? Because for some people, the idea of throwing out cigarettes makes them uncomfortable. So sometimes they just want to get rid of whatever they have left. I meet them where they're at. Do they need to tell people in their life that they're going to be quitting smoking, so they get that support from them? Because often that's important, right? I tell people when they quit, tell everyone in your life, because it's much harder to not follow through on it if everybody in your life knows you've quit. It's that kind of element of peer pressure. Now, that the other side of that is sometimes that guilt when they relapse. But I find that in general, it's more of a positive for people in their life to know that they've quit and that they're planning on quitting than not. So setting a quit date's important. Again, regular follow-up with their doctor will obviously be important, because it's one thing for wife, kids, friends to nag, and for that to become a kind of a bit of a conversation that may not go well and maybe kind of fraught with some emotions, versus one with a physician where we can kind of be more matter of fact. We can insist they come back for follow-up. We can, they can open up with us where they may not open up with family. So again, following with a physician is always super important. Something that I find helpful with some patients is something called sobriety sampling. And sobriety, think of alcohol, but we'll use this in the terms of tobacco too. That if someone hasn't really addressed quitting in a while, I'll put to them, are you open to, going a few days of trying not smoking with some other techniques we'll talk about, but at least trying it and seeing how it goes. Then we can follow up afterwards and talk about what went well, what didn't go well. Again, it often works well with alcohol as well, but even if someone tries to not smoke, they can at least get a sense of, number one, why do they smoke? Because we can get a sense of how do they feel with not smoking. and get a sense of what went well, what didn't go well, what can we address for the next time they decide to quit. So even if they're not ready to say, yep, I'm done, I'm never smoking again, even picking a little bit of a period where they agree to go smoke free and seeing how that went. A question I find very helpful asking patients is what went well in the past with their quit attempts? Because a very easy way and a path to finding out what's going to work for them for future quit attempts is not trying to reinvent the wheel, but going back and saying, okay, what worked for you? Because some patients who've, the average person takes 3 to 4 times or even more to quit. And it's helpful to go back to those quit attempts to say what worked, what led them to smoke again, because that's going to be important to kind of strategize and try to avoid those pitfalls the next time. So always asking patients kind of what went well in previous quit attempts and kind of what led them to smoking again. Okay, we're going to take a quick break, and when we come back, we're going to talk about some medication options to help you quit smoking. All right, welcome back. With the few minutes we have left, we're going to address some medication options for patients who are interested in actually quitting smoking. So the first one that I throw out to patients is nicotine replacement therapy. And this comes in many options. So you have the patch, the gum, the inhaler, the quick mist, a lot of different options that you have. And the thing that people need to know with nicotine replacement is you can use nicotine replacement and smoke at the same time. Okay, they're not mutually exclusive. We use it in patients to try to reduce their overall amount of tobacco and the amount they're smoking. But just because they've committed to using the patch or to using the gum, doesn't mean that they can't smoke at all. We prefer them to not to smoke because it'll make it easier, but it's not that it's one or the other. And one thing that I find works often really well with patients is if they use the patch, the step 1 patch often, if they smoke usually a pack a day or more, then they can use through the day as needed gum, inhaler, quick mist when they find they have cravings above and beyond what the patch is giving. And then over the course of weeks to months, they can reduce the amount of the patch they're using. But again, talk to your physician. They'll give you specific instructions around this. Option number 2 for quitting smoking is something called Bupropion, or Wellbutrin is the name. This is a medication that's dosed either once or twice a day. It's an antidepressant. So in patients who have depression who also smoke, this is a decent option, which you can speak about with your physician. Often, and it's associated with weight loss, this medication, because I know some people when they smoke, they find they gain weight. It's not the fact they're not smoking that's causing you to gain weight. It's the fact that people often have hands that are attracted more to food, and they're often eating more during this. So that's why they're gaining weight when they quit smoking. It's not that anything metabolically is changing when they quit smoking. So Wellbutrin is weight neutral and actually gives a bit of weight loss. So if people find that they gain a lot of weight when they quit smoking, Wellbutrin may be a decent option. Option number 3, and this is actually probably the most effective option of the group, is something called Champix. It's a medication that's taken, you build up over the first 2 weeks. There's a schedule you take. And in the second week of taking the medication is when you set your quit date. I often find this medication to be very, very effective in people who are motivated to quit smoking. It's for a total course of 12 weeks. You can do another 12 weeks after that if you find that at the end you're still not confident that you've kind of kicked it, but at least 12 weeks we recommend you stay on it for. Side effects in some people, some very vivid dreams, and in some people a fair bit of heartburn. But again, that's not everybody. And if you get those side effects when you're on it, you just stop the medication and you're okay afterwards. Again, speak to your physician about this. You'll need a prescription for at least the Bupropion and the Champix. So speak to them about risk and benefits, but just giving you a bit of information here. Vaping is the last thing people ask about. Should I vape? Should I not? Generally, if you can quit smoking and not vape, that is to me the perfect scenario, because do we know much about the long-term effects of vaping? We really don't. Is vaping probably safer than cigarette smoking? Yeah, probably. But again, if we can prevent you from having to breathe anything in long-term, that would be ideal. But if someone says to me that they can't quit smoking without vaping and that vaping is the only possible way that they'll quit smoking, I agree with them on that. And, I prefer them to vape over cigarette smoking in that case. But again, if they can go without either, that would be ideal. So again, speak to your doctor. Again, if you do smoke and want some help with this, if your family or friends smoke, encourage them to see their doctor. Because again, we're here, we're trained to try to help patients with this. It's not easy to quit smoking. If it was, no one would smoke, right? No one wants to pay the money. No one wants to take the risks of tobacco smoking. But again, it's a very difficult habit to break. And again, speak to your physician. That's what we're here for, to help with these things. All right. And until next time, stay healthy.